questions based on your Mycoplasma pneumoniae content. Each question includes 5 answer choices, the correct answer, and explanations for why the others are incorrect. Great for mastering the concept. Question 1. A 19-year-old college student presents with a 7-day history of headache, dry cough, and low-grade fever. He feels relatively well and is active, but was sent from his dorm clinic after his chest x-ray showed diffuse interstitial infiltrates. Labs reveal elevated cold agglutinin titers. Which of the following is the most likely causative organism? A. Streptococcus pneumonia, B. Chlamydia pneumonia, D. Mycoplasma pneumonia, E. Haemophilus influenza. Correct answer, D. Mycoplasma pneumonia. Explanation. Mycoplasma pneumoniae is the classic cause of walking pneumonia in young people 30, especially in crowded living situations like dorms and military barracks. Symptoms are mild despite abnormal CXR findings, interstitial infiltrates. High cold agglutinin IgM titers are characteristic. No cell wall, hence penicillin is ineffective. Why not the others? A. Streptococcus pneumoniae causes lobar pneumonia, more acute and severe, seen on gram stain. B. Chlamydia pneumonia also causes atypical pneumonia, but cold agglutinins and diffuse interstitial pattern are more classic for mycoplasma. C. Klebsiella pneumonia causes typical pneumonia in alcoholics diabetics, produces thick bloody sputum, currant jelly. E. Haemophilus influenza causes bronchopneumonia and often affects those with COPD or elderly. Question 2. A 22-year-old military recruit presents with low-grade fever, sore throat, and persistent dry cough. Chest x-ray reveals patchy infiltrates, but physical exam is unremarkable. Blood tests show anemia and positive cold agglutinin test. Which of the following best explains why beta-lactam antibiotics would be ineffective in this case? A. The bacteria are intracellular and avoid beta-lactam action. B. The bacteria are resistant due to efflux pumps. C. The bacteria lack a peptidoglycan cell wall. D. The bacteria have altered penicillin-binding proteins. E. The bacteria produce beta-lactamase. Correct answer, C. The bacteria lack a peptidoglycan cell wall. Explanation: Mycoplasma pneumoniae lacks a cell wall, so beta-lactam antibiotics like penicillins and cephalosporins, which target peptidoglycan synthesis, are ineffective. It requires treatment with macrolides, doxycycline, or fluoroquinolones. Why not the others? A. Intracellular bacteria. Not the primary reason beta-lactams fail. Mycoplasma can be extracellular. B. Efflux pumps. Common in other resistance mechanisms, e.g. tetracyclines, macrolides. Not the key issue here. D. Altered PBP's mechanism of resistance in RSA. Not relevant here. E. Beta-lactamase would be relevant in beta-lactam resistance, but not in mycoplasma, which has no target for beta-lactamase to act on. Let me know